Yeah, hi, good evening, doctor. Santosh, is it a Facebook Live?
No, no, sir.
It's a Zoom, huh?
Yes, sir. It's only Zoom.
Can you put it in Facebook also, the link?
Yes, yes, sir.
Yeah, thank you.
So, hi everyone. So, I'm Santosh. So, today,
Santosh, do the recording, please.
yes, yes, sir. So, hi, I'm Santosh. So, today's topic is COVID and your heart health. So, the speaker, the Dr. Deshpande, is very renowned cardiovascular and thoracic surgeon with years 10 years experience. So, the topics which will be covered by today is topic heart attack increases because of COVID. What is the effect of lockdown on heart diseases? Relation with COVID and heart diseases? Does vaccination cause sudden heart death? And how to avoid sudden cardiac events during vaccinations? So participants or audience, please, you can ask any queries at the end of the session. Thank you. Dr. Swapnil, please go on, sir. Dr. Swapnil, you are not audible. No, no, Dr. Swapnil.
You're not audible, sir. Santosh, I guess Dr. Swapnil lost.
Dr. Swapnil, please unmute yourself.
Yeah, I'm audible now.
Yes,
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 sir,
Dr.
you are
Swapnil.
audible.
Yeah. Hi. On occasion of World Heart Day, that is 29th of September, I wish everybody a very happy and healthy World Heart Day. I am Dr. Swapnil Deshpande, cardiac surgeon from DR.K.G.Deshpande Memorial Center, Nagpur. Actually, this is a very interesting topic which we are discussing today, and there are a lot of myths and a lot of beliefs amongst all of us regarding what is the effect of COVID on heart disease, on heart. It has been very well documented that with the incidence of COVID, the incidence of heart disease has also gone up. But it does not mean that you are always have to be very frightened about it. Your proper knowledge and education and proper medications taken at right time will definitely help you in avoiding heart diseases along with COVID. Hello.
Yes, Dr. Swapnil, you are audible.
Yeah.
Please go on.
Yeah. So the first and foremost is with the incidence of COVID, the heart diseases and heart attacks have gone up. And the basic cause for this is COVID has increased the formation of clots in the blood vessels. It is not just heart attacks, it is also blood clots present in the hands, present in the legs, present in the abdomen, present in the brain, and they have led to many, many problems. Many patients have lost their hands, many patients have lost their legs, many patients have had strokes or paralysis, and many patients have got their heart arteries clogged because of clots, and that's why they have had heart attacks. It has been found out that immediate intervention, that is angioplasty or putting a stent in such patients, has been very disastrous, and patients have not been able to make up after the heart attack and undergoing angioplasty. So it is always better to give uh, a proper uh, systemic therapy in the form of thrombolysis, in which we put up a drug inside the body, and that causes the breakage of these clots and releases the blood supply to the heart vessels, and that most of the times has been found life saving for most of the patients who have undergone heart attack when the patient is COVID positive. Now, the second term is when the patient has been treated of COVID and later on the patient has had a heart attack. In these patients also, many patients have had blood clots as the cause of heart attacks. And the avoiding such heart attacks is taking proper drugs if the patient is having have had severe symptoms of COVID. If his COVID CORAD score has been more than 14 or 15, it has always been a practice to start blood thinners in the form of newer oral anticoagulation agents, with which these clot formation have got reduced, and hence these patients have got benefited in prevention of heart attacks after COVID. It is always better, but these drugs have to be prescribed by a doctor and should be in close monitoring with your cardiologist. Because once the patient is on oral anticoagulation agents, the blood of your body becomes thin, and these cause increase in bleeding tendencies. You might bleed from the teeth, you might bleed in your abdomen, you might bleed in your joints, you might bleed in your brains, you might have severe uh, acidic problems because of bleeding and because of ulcers. So it is always under maintenance and always under the therapeutic guidance of a physician. If that will prevent heart attack in patients who have had COVID. Third problem is because of lockdown, there has been lot of inertia of people getting outside of the house, and that's why their exercises and all have been hampered. Many patients are coming to us with the problems of having breathlessness on walking, which has started after lockdown. So because they have been inside their homes, frightened to get out, and reduced exercise, increased intake, increased obesity, and that has led to lot many patients having more and more heart problems. There is a proper correlation between lockdown and heart diseases because of lack of exercise. And that's why we advise the patients to start exercises, and then start exercises in a gradual and graded manner, and not in very haphazard or very excessive manner. Because if you do in very haphazard or excessive manner, that can lead to immediate heart attacks at times. Not for everybody, but some susceptible individuals can have heart attacks because of that. Thirdly, there is an increased incidence of thrombus formation, that is clot formation, in many of our patients who have had a valve replacement problems, underwent surgery previously, and now they have COVID. Because of COVID, because of the increased formation of clots, these clots have got lodged up into the valves, and they have got called wall thrombosis, which has caused obstruction of the valves, and they have led to sudden cardiac deaths or severe compromised breathing problems. And patients have come to us in emergencies and have landed up into redo surgeries. So these are the problems of COVID and heart, in which there is immediate problem of clot formation. So that's what you have to keep in mind, is that there is a chance of heart attack, there is a chance of clot formation, there is a chance of a wall thrombosis, and that has to be treated very, very aggressively. But at the same time, it has to be under a therapeutic guidance, and you have to try to reach the doctor as early as possible. Okay. Hello.
Yes, sir, you're audible.
Yes, sir.
Yeah. So next comes is the COVID and vaccination. Indian government, we have to thank the Indian government, especially our Prime Minister Narendra Modi ji, to have started this vaccination program and has successfully run this vaccination program in a vast country like India. It is very, very commendable for the government of India to have reached 200 crores of vaccination. And India is being looked upon by various countries, including USA, England, and Russia, in management of COVID and management of COVID vaccination. COVID vaccination is a must for everybody. And we have seen that patients who have been vaccinated with COVID, they are definitely having less symptoms of COVID, and this definitely having very, very few complications related to COVID. There has been some stray and sporadic cases in which the COVID, there have been some stray, there have been some stray cases of COVID. Just a minute, yeah. There have been some few sporadic cases in which vaccinations, patients who have been vaccinated after COVID have had a sudden cardiac death. There is no hiding the fact that there has been few cases, but they have been very, very far and few. On investigation, it has been found out that some of these patients have had some problems of heart disease, for which they were taking some blood thinners in the form of ecosprin, clopidogrel, or acetron. And during vaccination, the patient had been advised stoppage of these blood thinners, which have led to problems. So it is my sincere request and sincere advice, that is to, if you are on any blood thinners, please, please, please do not stop these medicines during and after vaccination, because if you are on these medicines, then no problem will happen. It is, even we have taken vaccinations of second dose, third dose, and everybody in our family have also taken second dose and third dose, and nobody had a problem. There have been few cases in which there has been a problem, but the thing is, we have to see for the greater good, and we have to see for the protection of ourselves and our families and our next generations from COVID. And for that, vaccination is primary treatment and primary mode of prevention. Okay. So, is there any questions regarding these topics?
Doctor, the question is from my end. So
Yeah.
I'm seeing there's a lot of reports which is getting published, and there are a lot of studies which are saying that the vaccination could have been the one of the reasons, and especially the mRNA one. Okay, so what is your thoughts about it?
See, basically, vaccination has been one of the methods with which we have prevented spread of COVID and have prevented decrease in the symptoms and severity of COVID, for which the third wave was not very difficult. The second wave was very, very grave. But because of the vaccination, the third wave, in which the vaccine virus was even more infective, was spreading even more, Still, we could make out without any hospital admissions or very few hospitalizations. So vaccination have definitely prevented that. But COVID vaccine has shown to have some individuals hypersensitivity in some individuals, which have led to formation of these clots and sudden cardiac deaths. So that is the reason why COVID vaccination has come into disrepute. But it is no need to get frightened of it. If the important thing is, if you are on some medications, please do not avoid those. Please continue on those medications and then take your vaccine. Only then these complications will be very, very less.
Sure, sir. Thank you.
Yeah.
So there's another myth. I don't know, is it correct? A lot of people are saying that if you have had a cocktail vaccine, a lot of people have been, they say there's the heart attack and cardiac arrest were
Yes.
more. Is it true, or
Thing
what's
is,
your?
so because these viruses, the vaccines which we are taking, they are live vaccines, live attenuated vaccines. Live attenuated vaccine means the virus is alive, but its virulence is reduced. Virulence is reduced means the infective part of that virus is reduced. So it is depending upon individual patient. Yeah, depending upon the individual patient's immunity and individual patient's hypersensitivity, these viruses, these vaccines react. Some patients, some people have increased fever, increased symptoms. Some patients have absolutely nothing. So it is always better when you have a newer vaccine, like a COVID vaccine. It is always better to take it as a single vaccine rather than take it as a combination of along with H1N1 or influenza vaccines. It is always better to take individual vaccines, because the other vaccines which we take as a mixture of vaccine or a multivalent vaccine, they are all tested vaccines, time tested vaccines, and they are dead vaccines. I mean, dead virus vaccines. These are live vaccines. So it is all, and they are newer vaccines. They have been started up in therapy is as a very, very special case of patient administration. The long-term results are still yet to come. Even we don't know what will be the long-term when we have to take additional vaccines, whether we have to take the fourth dose, whether to take the fifth dose, 6 monthly, 1 yearly. So it is always important to have take this vaccine individually and not as a combination.
Noted, sir.
Yeah. So what's the next point? Can I get the next point, please?
Relation with COVID and heart diseases.
Yeah. So COVID and heart diseases, which are testing, which we are seeing nowadays, is a coronary artery disease. That is the main disease which the patients after COVID is having. Coronary artery disease means coronary arteries are the arteries which supply the heart muscles. When these arteries get blocked or where there is formation of clots, these arteries causes symptoms. Patients can have breathlessness, patients can have chest pain, or patients might just turn up with some vague symptoms of palpitations or giddiness. On investigations, we have found out that these patients have had severe atherosclerotic disease in which the arteries have blocked, and they need either angioplasty or bypass surgery, which also we have seen even after surgery, these patients have had some amount of lung injury during their COVID. They behave slightly more worse than patients who have had no COVID before surgery. So that's why patients who have undergone COVID, who have had COVID and are going to undergo an angioplasty or a bypass surgery, it is our normal practice that we make the patient undergo a CT scan, with which we find out whether these lungs are having some amount of uh, affection related to COVID, because these patients behave much more bad after COVID, after surgery. And that's why it is always of prime importance to find out these patients' residual defect because of COVID. So, and but these patients have had very very bad disease, but it is not. I mean, but it is not that these are inoperable patients or non untreatable patients. They respond good to our treatments, and they can have a good lifestyle if they do a proper chest exercises and lung exercises along with the cardiac exercises after surgery. That's how they are going to. That's the difference with which we have for a regular patients or with patients with our COVID and heart surgery.
Doctor, is there any changes with respect to the diet and lifestyle?
Most of the patients who go come to us as heart disease after COVID, most of the patients don't have to have any special change in their lifestyle or diet. Only thing they have to change is the way they do exercises. They do have to go for lung exercises along with cardiac and regular exercises, because these patients will have some amount of lung problems. Otherwise, diet and lifestyle modifications are not much required for COVID or non-COVID patients after heart surgery. But yes, these patients have a much more higher chances of having very severe disease. So their recovery period will be slightly longer as compared to the patients who are having non-COVID who are coming for surgery.
Thank you,
Sec-
doctor.
Secondly, the patients who have had steroids during their COVID treatment, these patients also behave in a very funny manner during our surgery. And it has been our practice to start these patients on steroids post-operatively as well, because these patients are shown to have some amount of increased lethargy, which is not amenable to treatment, not amenable to exercise. It is shown to have hearts which are which are much more resistant to our regular treatment. So these patients have to be started on steroids postoperatively again, and later on again these steroids may have to be tapered in a short period, but they are needed. So the patients who are treated with COVID, this history of having whether they had undergone steroid therapy during their treatment of COVID is very very important for us.
Thank you, doctor.
Yeah.
So one more topic is, what is the effect of lockdown of heart diseases?
Yes. Uh, there are two ways in which we see this effect. There are two groups of people. One is patients, people who are frightened of going out, and they have now become phobic of people. So this is one group. Second group is people now who have been in lockdown for 1.5 years, are now and working from home. They are the IT sector people who are not joining their offices, in which they are just working from their home, not doing any exercises, and now they have started to think about that. Now I have become overweight and I have to start gymming and all, and they have now started to do exercises. And third of people is people who are not cared of anything, who have not cared of and bothered of anything, and who are uh, uh, doing the regular activities as they are doing. So we first take the case of first people who are phobic. First people of phobic are they are totally means we have found out that mentally they are at times been destroyed and are under depression, and they really don't know how to interact with people nowadays. You know that human is a social animal, and now because of COVID and all being and they being locked getting inside the houses, they are now becoming antisocial people. And antisocial in any ways is not good, maybe in political, maybe in terrorism, or maybe in humor, in at work. And being antisocial is not good. So being antisocial means these patient people are getting into more and more depressions. More and more depressions is causing even blood pressures to go up, sugars to go up, and these patients are coming up to us in a very very bad state. And that is why it is very important to uh, make these people understand that yes, we have to take care. COVID is there to stay. COVID is here in our society. We are getting some patients still who are infected with COVID, but you cannot just be locked down in your houses. You have to come out. You take protection. You take your masks. You take your sanitizers. You be, but you get to the into the mainstream of the society again, because that is the only way you are going to be mentally sound. And mentally sound means your have body is also going to be sound. So it is very, very important for these people to understand that yes, COVID is there to stay and we have to take care of ourselves. But it is not that we can be locked down for life. Otherwise, government of India would have locked down for us for continuously till now. They have made us they have unlocked the ways. And that's why it is important to we get our minds also get unlocked and come out of our homes and get back to our society again. Secondly, the people who are working from home and are not doing any exercises, obesity has increased and increased, and we have found out lot many patients who have come in a very, very obese states. Even patients who have undergone our therapy after surgery also they have and after lockdown when we are seeing them in our OPD, many patients are being overweight and obese. And on asking them, they are just giving the reason that we have been in lockdown and we just because we have been eating and not doing any exercise or have not having any space for exercises, we are increasing in weight. And these patients have had come and with advanced diseases, and some patients have come with blocked grafts also. So it is important to identify these patients and treat these patients. Secondly, some patients, some IT sector group or some patients who are doing work from home, they have now decided to start their gyms and start their activities, start their exercises. Just a word of caution is you have to do these exercises in moderation. You cannot just start the way you were after pre-COVID. After COVID, you have to have some moderation because your body is not conditioned to do these exercises. Because you have been deconditioned, if you start immediately, it can cause very, very severe problems in the form of muscle injuries, joint injuries, and at times heart problems and sudden cardiac deaths. And that is one of the reasons why we are seeing so many patients who are reports coming up as sudden onset deaths in gyms or during playing. So the one of the important thing is because the person is deconditioned. So it is always better to get yourself in a slow and gradual way in which you get your exercises done. Another point which I will tell you is get your blood pressure checked, get your through a physician. If that is fine, then you can go on and do your exercises slowly. You cannot be a Ritik Roshan and John Abraham in 4 to 6 months. You have to have a sustained effort because they have done that for last 20, so many years, and that's why though now they have this six pack abs and a good figure of give muscles. You have to exert like them to get to that stage, but you need to give time as well. Third and more important thing is when you have these gymming exercises and all, you are going with some protein fats or diet fats. You have to be very, very careful in having these supplements, protein supplements, diet supplements when you do this gym because not everybody is tuned to have this much amount of proteins every day. So it is always better to have a consult a dietitian or a physician and get your body, get them know your body so that they can advise you properly as how to take diet supplements. That is very, very important. Third thing, and the third, then coming to the third group is the people who have not been worried too much about the COVID and all. Frankly, we have found out these people to be most of the times having not much problems, but that does not mean that we should not be careful enough to protect ourselves. They have been found out to have COVID, which never was picked up, and they have got some amount of lung and heart injuries, which in the long run is going to hamper them, and it is irreversible at times. So it is always important to know what type of person you are treating, and then we can do treatment properly. And last but not the least, which I can tell you is the mobiles screen time, laptop screen time, and TV screen times. With COVID, and everything coming to your screens, the screen time of every person, including myself, has increased. There is no person in the world who has not started to increase his mobile use. The OTT platforms and the TV platforms have started giving 24-hour service of various movies, various series, and all, with which they are seeing lot and lots of TV and lots of mobiles, lots and lots of laptops, lots and lots of tablets, with which what is happening is they're getting their time invested in the screens completely. There have been many instances in which young generation especially have been binge watching lot of series. It's been advertised also like the series have to be binge watched, and what happens during that period is they binge through the night, de- deprive themselves of the sleep, deprive themselves of everything. Secondly, these OTT platform series are very dark, very violent, very abusive. That causes an additional impact on your mind. Thirdly, in order to keep yourself awake, you continuously binge on eating. That's another binging what you're doing during that binge series. So that is causing more and more damage to your body. If you're not sleeping at right time, not eating at right time, not eating properly, that is going to cause trouble to your body. And once this body gets troubled, you are going to come to see us. It's no point that we are going to be having more and more patients of such types, because these patients are addicted to this OTT platforms, which we call this as screen addiction. And you take it from me that these patients are increasing in our practice, and even after surgery they are demanding mobiles to us to see the series. So that is what is the gravity of the situation, and this is one of the very important problem of COVID and lockdowns, and we have to take care that this does not perpetuate very severely in our families, including small children. Online schools, anyways, have made them slaves to the mobiles and laptops. Luckily, the schools have started. We have to take care that these children do not open the mobiles continuously and have a reduced and graded screen time. Because technology is there and going to be there to stay, and we have to take advantage of technology, but we should not be just slaves of technology and mobiles and TVs. So that is very important message to be conveyed to everybody who is now much and more addicted to mobiles and TVs. It is better to watch a single TV serial every day, but one episode, not in all the episodes of the series in one day. It is not healthy, and that is going to cause more trouble. So it is always better to have a graded TV and laptop screen time nowadays.
Well, thank you very much, sir. That's been a very insightful thing. In fact, it's very correctly said that we get to see more on youngsters, and not only from the cardiac aspect of it, the mental behavior, insecurity, and unwanted content thought process. It's coming up. So that's very well said. But out of curiosity, I wanted to ask you one thing in your practice, and what's your say about genomics and personalized medicine or targeted therapy when it comes to cardiac health?
Genomics and personalized health therapy at present is still in a very infant stage, I will say, in cardiac therapies. It has been found out to be somewhat useful in some spinal or vertebral column diseases, but at present, at still in the cardiac point of view, it has been still very difficult to say its utility, because the experiments still not have been very fruitful. Also, the mimicking of the heart diseases of humans in animals is not yet been possible. There have been very few diseases in which there have been some iron deposition or copper deposition in the heart, which have been found out, in which genomics have helped. But otherwise, at present, genomics in cardiac surgery or cardiology has been still in a very infant and experimental stage. Sorry, I didn't get you.
Much. And I said thank you very much. I understand, and
Yeah.
I understand that it's in very nascent stage, and probably that the targeted drugs are not in
Yes.
place, or probably those might be in some pipeline.
Yes.
Thank you, sir. So, Santosh, do you
Okay,
have
sir.
any other questions?
Yeah. So the most of the patients have taken the remdesivir corticosteroid drugs.
Yes.
Is that affects any serious diseases to the heart patients?
See, basically, steroids are the drugs which make you feel good. Okay. And they have been made useful in form of treatment of COVID. And secondly, whenever there is any additional inflammation, that was which we were saying in the cytokine storm or the second stage of COVID, steroids were very, very useful. But with steroids, increased steroids, it has been found out that the patients have increased blood glucose levels. So patients have had steroid-induced diabetes, or patients who have had a borderline diabetes have had undergone an unmasking of diabetes in their disease process. So once the diabetes sets in, the patient's lifestyle and quality of life decreases very, very fast. And it is and that has also perpetuated the increase in incidence of heart disease. So use of steroids itself has been very, very important, an important marker of patient treatment of patients with heart disease in after COVID, especially after COVID, because post-operatively also we need some steroids for them. And patients who have increased sugars, they have even more sugar rise after use of steroids. So you have to manage those sugars. Increased sugars cause chances of infection. So post-operative infection chances increase. So you need more antibiotics for them. So that's how the whole cycle goes. But we have to grade ourselves into what is more important for the patient, and then depending upon that, we have to give the treatment accordingly.
Thank you so much, doctor. Thank you so much.
Yeah.
So there's a one more topic like we need to cover.
Yeah.
So how to avoid sudden cardiac events during the vaccinations?
See, once there are two things in it. One is a patient who is healthy, and second is a patient who is having some disease, who is both of them are going for vaccination. So a patient who is healthy with vaccination, you have to only keep in mind is you have to take adequate oral fluids. The moment you take adequate oral fluids during and post vaccination, your the tendency of blood clots reduces a bit because your blood becomes less viscous. And secondly, you have to if patient gives if you have any symptom of some amount of chest pain, left arm pain, or increased breathlessness after vaccination, it is very, very important to consult your local doctor and get your blood levels checked and get your ECG checked, because it does generally takes a while to start these symptoms. So it is always better, if you have some symptoms, go to your doctor and get it checked. That is the only way to prevent your sudden heart deaths after COVID vaccination. Second thing is the patients who are on some medications and who are going for vaccinations. Of these, some patients who have undergone bypass surgery or undergone an angioplasty, or on some or who have undergone bowel replacement surgeries, or patients who are diabetics and taking some blood thinners, it is important, and most important thing is not to stop this blood thinner therapy during vaccination and after vaccination. There has initially in the first year of vaccination, it was being advocated that you stop these blood thinners 2 days prior to vaccination and start it 1 day after vaccination, with which the injection which you take in the muscles don't cause a blood to form here at the site of injection. But nowadays the concept is you avoid stopping these medications and just press the area where you have taken injection just 2 to 3 minutes more than the normal time. Normally we press it for half a minute to 1 minute. You press it for 3 minutes, and then just observe the area where the blood where you have taken injection. And if there is still blood coming out, press it for a couple of minutes more. That is the only thing you need after taking vaccination if you are on blood thinner therapy. Secondly, you have to take care during that is you have to keep on observing the site of injection next 2 to 3 days whether there is formation of collected blood. That is called as hematoma. That is important because this hematoma can get infected and then that patient might have some problems, infection problems. And that is especially important in patients of valvular heart disease who have undergone wall replacement surgery, is that this infection get lodged into your heart and this wall can get damaged. So it is important to observe this, and if it is there, you have to go to the doctor and get it drained and remove that hematoma so that there is no chance of infection there. So these are the only, and but never stop your blood thinner drugs. So this is the only way you have to prevent. You can prevent your vaccination induced sudden cardiac death.
Thank you, doctor. Thank you so much for giving us so very good insights about the cardiac health in the COVID situations.
Yeah.
So it's a very good time that we have got all the information which we are very keen to listen. So thank you so much, sir. Thank you so much, doctor.
Thank you so
So
much.
the participants who are missed the live sessions will be posted in the social pages. Please
Okay.
do follow.
Sure. Okay. Thank you so much.
Thank you, doctor.
Thank you, sir.
Thank you.